Hey everyone, this is Dr. Nitin Yashas from Alterdoctor, and we are here with a very special episode to talk of one of the most burning issues, one of the most confusing period in a medico's life. And trust me, there is no neat solution for this. Yes, I'm of course talking about NEET PG 2022 counseling, and this is a time when a lot of doubts, a lot of questions, a lot of confusion goes through the minds of an aspirant as such. And while this video may actually not give you all the answers and might not solve your doubts, I do hope it gives you some perspectives, and more importantly, it provides you some advice on what is the most important questions that you need to ask and what is the information you need to look for before you make that all important decision. So some of the questions that I would be covering in this talk are: do I just choose a seat because I'm getting it this time when I've written it for the first time, or do I wait for it? Do I give preference for a subject, or do I give preference for a college? What are the factors that should be considered while choosing a college, or how do I go about choosing a subject? So the first question that most of us face is, do I actually choose a seat this time? And this is a question which is faced by most of the mid-rankers who do not know whether they would get a seat of their choice or whether they would get a college of their choice. Now, remember, it is okay to lose 1 or 2 years to get what you really want rather than end up taking something just because you're getting it. Because remember, this is a decision which you have to live with for the next 20 to 25 years. And this is what is essentially going to define your career, especially if this is your first attempt and if your preparations have not been adequate for some reason or the other. Or for example, on the day of the exam, you blanked out or you made a lot of silly attempts, then it is better to not take any seat just because you're getting it, but rather try to put all that energy and refocus and try to prepare well for the next set of exams as such. However, if this is your third or fourth attempt and you know that you've given it your all and this is the best performance that you have ever given and you do not have the motivation to slog it out for the next 6 months as such, then it is better to look at all the options and take a seat this time. So the same principles can be applied for the next question, which is essentially, do I give preference to choosing a subject or do I give preference to choosing a college? And in my opinion, the answer is really simple. It's always subject over college as such. And the reason, like I said before, is very simple. Post-graduation is tough. It is going to be hectic. You are going to endure long working hours, sometimes double duties. There are going to be issues at workplace which can come up. But all this is manageable and bearable if you're really passionate about what you're doing. And that is why you need to follow your dreams and you need to choose a subject that you like so that all the other obstacles that come in the way, you have the motivation to conquer it. And remember, again, do not think of just short-term difficulties and obstacles when choosing a postgraduate seat. If you really like the subject and are passionate about it, think long term, because whatever post graduation you choose, and if you're wanting to continue in the medical field as such, this is the stream of specialization you're going to be in for the next 20 to 25 years. So therefore, it is okay to choose a subject that you really like in an average college rather than choosing some subject that you had no idea about, but you're getting it in a college of big reputation. Please always, in my opinion, give preference to the subject that you like. But moving on to our next question, let's assume that you have decided on 2-3 subjects. How do you go about deciding a college? Now, according to me, there are two most important factors you need to look at when choosing a college. Number one, what is the exposure to a variety of cases you would encounter during your post-graduation period? And two, how much independence are you given to take decisions, or how much surgical chances are you given to perform independent surgeries under supervision? Nothing is more important than the number and the variety of cases you see during your post-graduation period. Therefore, it is very important that while you're inquiring about colleges, that not only you inquire about the volume of cases, but also the variety of cases that you're likely to encounter. It is very important to emerge as a competent professional once you finish your post-graduation. And one important aspect which plays a huge role towards this is the ability to take independent decisions during your post-graduation period. For example, if you're in general medicine, are you able to independently work up cases and make a treatment plan in your final year, which is approved by the seniors and professors as such? Or are you able to perform surgeries independently, especially in final year under supervision? And do you get opportunities for that? These factors are very important to be considered when choosing a college. The other most important question which comes is, how much weightage should I give to a structured academic program in the department? Now, rather than talking about the structured academic program, you need to find out, is there an academic atmosphere in the department? Do the faculty teach on rounds? Are there bedside case discussions? Are there good quality case presentations which happen on a regular basis as such? Is there opportunities to discuss about evidence-based medicine and the latest articles in Journal Club and implement them in practice? Are there opportunities to do research and training? Because in today's world, where you have up-to-date clinical care option, Med Twitter, YouTube videos, and many such platforms, which you need to, in fact, use to enhance your postgraduate training, having a structured teaching program is actually redundant and may not be required. And these are the other factors that you need to inquire, especially the fact that as a postgraduate, can you freely walk up to a faculty and engage them in a good academic discussion? That is more important to find out rather than about a structured teaching program. So are there any other factors to decide before choosing a college? I believe there's one important factor which not many people talk about, and that is the working environment. Try to find out if a good support system exists for postgraduates as such. Are the department faculty friendly enough for the postgraduates, particularly at the lower level of SRs and APs, where the postgraduates can approach them and discuss any matter, be it academic, career related, or personal as such. Try to find out about the working hours, especially with regard to the number of duties per month or per week that needs to be done, what happens post-duty, so that you know this information before you enter the department and are mentally prepared if it is hectic, rather than entering it without any of this information and then finding it too hectic that you would want to leave the course. Try to find out also whether there are recreational opportunities available at the college, be it sporting events or cultural events, which postgraduates can indulge once in a while. All these factors are very, very important to avoid burnout as such. The other factor to consider is also, are standard of care facilities available round the clock? Quite a few government colleges do not have MRI, the latest antibiotics, or certain investigations available 24/7. So if I were to choose between a government college which has a huge number of cases, but would essentially sometimes refer out certain cases because of certain facilities lacking, versus a teaching private college which would have all these facilities and treatment options available round the clock and has a decent number of cases, I would definitely choose the second option. Of course, it is also important that you do your homework very well and log on to the important websites or the relevant websites and find out about the fee structure, the counseling rules, and also more importantly, the bond rules in each state. That is an important information which will play a huge role in what college you decide to choose. So coming to one of the most difficult questions, how do I choose a subject? Well, it's a very personal question. You need to first understand what kind of a person you are. Are you someone who is more inclined towards medical specialties and diagnosis, or are you inclined towards surgical specialties, or are you someone who is very academic and research oriented and are inclined to the pre and paraclinical subjects? Now, the other way to make this decision is, do I choose a broad specialty or do I choose an end specialty? Now, of course, these days, even end specialties, be it anesthesia, ophthalmology, also have subspecializations with fellowships, though, of course, not all of them require an entrance exam like NEET super specialty. It is also very important that before you choose an end specialty, you have adequate knowledge of it. Because in our medical education system, end specialties such as anesthesia, ophthalmology, psychiatry, dermatology, radiology, we all have very limited exposure during our 4.5 years of MBBS and 1 year of internship. Therefore, it is very important that you spend time talking to the people who are currently pursuing it, who have passed out, and also the more experienced ones, to get different perspectives rather than choosing these end specialities just because of the hype associated around it, or because the so-called toppers are choosing around it, or most importantly, most of them choose it thinking that there are chill working hours or I'll be able to make money right after I pass out. Remember, when you talk about scope of a subject, it is dependent on a variety of factors. You cannot predict what the scope of a subject is going to be 3 years down the line. And it is very dependent on which area you're going to practice in. Are you going to practice in a tier 1 city where there is saturation in most of the subjects, or are you going to practice in tier 2, tier 3 cities? So don't just make your decision based on scope, which would keep changing year after year and based on various factors that I have mentioned. But one of the best ways to find out about a subject, and I really hope that this concept kickstarts in India, is the concept of shadowing, where if a candidate likes a particular subject, he or she gets the opportunity to spend sufficient time in that department, either in the college where they're already doing their MBBS, or in another institute where the department is of a top-notch level. Spend at least 2 to 3 weeks, shadow different people at different stages of career, try to understand different perspective of what happens in that subject at various stages of career, and nothing can give better information than this. With that, we come to the end of this very special episode. If you have any comments, perspectives, or questions, please do type it in the comments and we'll try our best to answer them. We do really hope that this video provided you some insights on how to go about to try to choose a seat during NEET PG counseling as such. Until next time, we really hope that you subscribe to our channel, Alterdoctor, on YouTube. You can also follow us on Instagram and Facebook. Until next time, this is your host, Dr. Nitin Yashas, saying goodbye.